How to Help Prevent Child Sexual Abuse, Kansas Children's Service League. The first step in preventing child sexual abuse is knowing the facts. 1 in 10 children will be sexually assaulted before their 18th birthday. And although there have been several high-profile abduction cases in the news, 90% of abusers are someone the child knows, loves, and trusts. Another fact often neglected is that almost 40% of perpetrators are older or larger youth, not adults. 20% of child sexual abuse victims are under the age of 8, and many victims do not tell anyone for years. There are several different types of sexual contact. It can include any contact between an adult and a minor, or between two minors when one is exerting power over the other. However, there are several acts that don't include physical contact, including exhibitionism, when a person exposes themselves to a child, exposure to pornography, just having children watch pornography or participate in pornography, voyeurism, which would include watching a child undress for sexual gratification, and communicating in a sexual manner by phone or internet. All of these experiences can be agonizing and traumatic for the victims and are crimes punishable by law. When adults understand more than 80% of child sexual abuse occurs in isolated, one-on-one situations, they can make changes to protect children. The best way to minimize risk is to eliminate one-on-one situations where children are alone with an adult or older youth. You can do things like leave doors open. Implement a two-adult policy. This policy helps protect the child as well as an adult. Monitor internet use, and ensure youth organizations have implemented and are following prevention policies. Talk to children about their body parts and use the proper names. Having children know the proper names helps to avoid confusion if they need to tell someone about abuse. There is nothing embarrassing about the word elbow, and using correct terms like penis and vagina don't need to be embarrassing. Keep it matter of fact. Explain some parts of the body are private and should not be touched by others, including children or youth. Talk to any adult who comes in contact with your children, including program supervisors, teachers, or coaches. Tell others you have talked to your children about preventing child sexual abuse. Perpetrators are not interested in children who have been educated or families who are aware of child sexual abuse. Drop in unexpectedly, and listen to what your children say, and also listen to what they don't say. Pay attention to the child's body language and notice if they avoid talking about a certain person or become visibly uncomfortable. Allow and encourage children to trust their instincts. For example, if they are uncomfortable giving an aunt or an uncle a kiss, don't send mixed messages by forcing them to do so. Respect your child's boundaries. And as the adult, trust your instincts, even if it seems unwarranted. You are your child's greatest advocate. The following are some signs and symptoms of child sexual abuse. Not all children who have been sexually abused will show signs, and not all these signs indicate a child has been sexually abused. These examples provide a guideline and should raise red flags for caregivers when displayed by children. Examples include excessive seductiveness, a child or sibling taking on the role of a parent, massive weight change, either gaining a lot of weight or losing a lot of weight, suicide attempts, a child that has an inappropriate understanding of sex for their age, a child that's threatened by physical contact or closeness, and any redness, rashes, or swelling in the genital area or a urinary tract infection should be carefully investigated. If a child discloses to you or tells you they have been sexually abused, do not overreact. The child has chosen you as a person they can trust, and your reactions are important. If you remain calm and attentive, you will help the child feel safe in their decision to tell. Only ask open-ended questions, like what happened next. Avoid asking leading or yes or no questions, which can confuse a child or distort their memory. Questions like, did he lay on top of you, should be avoided. Allow a professional, like a social worker, police officer, or someone from a child advocacy center interview the child. Most importantly, tell the child you believe them, you will get help, and that telling someone was very brave. Whether a child discloses or tells you that abuse has occurred, or you only have a suspicion of abuse, it is your duty to report. And if you are a mandated reporter, it is the law. To report in Kansas, call 1-800-922-5330. Or if you suspect the child is in immediate danger, call 911. For more information on child sexual abuse, please visit the following sources. To find a child sexual abuse prevention training near you, visit Darkness to Light or Kansas Children's Service League. This video was produced by the Kansas Children's Service League. Kansas Children's Service League is the Kansas chapter of Prevent Child Abuse America. For more information about Kansas Children's Service League and the programs provided, please visit us through the following sources.